Good afternoon, everyone, and thank you so much for dialing in to our webinar on the pharmacy tour, which is full of tiny details that can have a big impact. Our panel of experts today includes Lesley, Malus, Susan DeMarino, and Judy. I'm going to let each of them introduce themselves. Lesley, why don't you get us started?
Sure. Good afternoon. This is Lesley Malus, and I'm president of IHS. We have been doing this pharmacy thing since its inception. We were actually invited to be consultants on Your Experts Beta. So we know a lot about this, and we're very excited to talk to you about it today. Sue?
Hi, I'm Sue DeMarino. I'm the Chief Clinical Officer at IHS. Prior to joining, I worked at URAC for 17 years, and I have been in many pharmacies since in my experience, and I'm really excited to be here today. Judy?
Thanks, Sue. Good afternoon. I am Judy Coon. I am the Senior Pharmacist Consultant with IHS, and my background is long-term care pharmacy, where I was the pharmacist in charge of the clinical services, as well as the operations for pharmacy services. So I've been with IHS not quite a year yet, but was with URAC as a consultant for about 4 years, so not quite as much as Sue, but glad to be part of IHS and helping clients prepare for URAC and ACHC and other accreditations. So thanks for having me.
Well, thanks so much for joining. We're really excited about today's webinar. A couple of notes for our audience out there. You do have a chat window where you're welcome to comment, ask questions, and I'll be posting some notes as we proceed along. Also, if you look to the bottom and left of your screen, you'll see our polls section where you can vote in our polls. We might add a few more as the webinar goes on. And more importantly, just to the left of the polls is the spot that says Ask a Question. If you click on that, you'll be able to enter a question at any point during the webinar. And you can also vote on questions to see which ones you'd like answered. We did take any questions that you put on your registration forms and go ahead and pre-populate that Ask a Question box with those. And we delight in your questions. Please contribute them generously. We would love to answer them for you. So with that, we'll go ahead and get started. Lesley, why did we decide to talk about the pharmacy tour today?
So I have been doing this for many years, and I think the part that gets most folks quite nervous is the tour of the pharmacy, the actual tour by the pharmacists that URAC sends. And when we do our tour, we take a much deeper dive, and it's kind of the place where we can find out where really the issues are in order to start our interviews. So while URAC allots 30 minutes, an hour to it, sometimes we take much longer than that because we are able to take that deeper dive, find the issues, and we decided, well, let's put everybody's nerves, let's settle them down, let's put them at ease, and give a webinar about this so we can talk about some of the shortcomings and the tricks that we find during the actual interview. From this point, Sana, I think maybe we should cue Judy to just let everybody know what happens during an actual on-site.
That sounds really good. And thank you for saying my name. I realized I forgot to say it at the beginning. So I am Sana Wrigley, and I'm the Chief Operating Officer at IHS and the moderator for all of our webinars. Judy, would you be willing to give us an overview of the pharmacy tour and what it entails?
Well, what I was going to start off with today as we're talking about the pharmacy tour and the validation review of the pharmacist reviewer that comes in is basically looking at the time frame that you have on the agenda when you are going through your validation review. Knowing that it's a very limited time that the pharmacist reviewer will have during that review period that day to be able to observe your pharmacy operations and address your pharm ops and your STROM and a few other standards. But I just wanted to point out that normally it's anywhere between 30 minutes to an hour out of the day for the pharmacy tour. And so in saying that, the point I'm trying to make is that you have to be prepared You need to understand what they're wanting to see and what they're wanting to for you to provide evidence of compliance for during that period of time, and then have it ready for them. So as we kind of walk through this today, just wanted you to keep that in mind about how limited the time period will be. And then as we walk through the different things they're looking for, have those prepared and ready for that time period and that tour on the agenda.
Well, thank you, Judy. I'm going to start off by talking about, as part of the tour, one of the things that occurs is that the pharmacy reviewer will interview your pharmacist, your technicians, your shipping folks. And one of the questions they always ask the pharmacist as they're doing their pharmacy verification twos is about state labeling laws. So the expectation is that the pharmacist can speak to what areas they dispense to, and then how do they know what the state labeling laws are. So it's key to have tools available for the pharmacists to be able to point to demonstrate that they do understand that there may be different labeling laws for various states. Some organizations will embed those state labeling laws into their systems. Other organizations will adopt the most strenuous from the states that they dispense to ensure that they're in compliance. But you want to have resources available for your pharmacists to point to during that tour. Judy, anything to add?
I think you covered it, Sue.
You know, I have something to add to that. I do
The
mostly
second thing that we're going to kind of mention today is as part of the tour that your pharmacist reviewer will be doing during your validation date is looking at your processes for packaging and shipping and your protocols for that. So a couple of things to keep in mind there is what your policies and procedures, how they read, how you are, the processes that you're using for packing out medications for shipping and or for delivery. And one of the key elements that they would like to see is a schematic or a diagram for your pack out process. So there'll be a couple of things they'll want to see. They'll want to see your pack out technician to perform an example, or if they're in the process of packing out something, looking to see what they're following in order to make sure that what one packing technician is doing versus another, then they're the same. And so two things that I kind of see as when I've had my pharmacist reviewer hat on, is looking to see if they're using the same protocols and the same processes for local deliveries as well as for shipping. And then as we address that, we're also looking at the cold chain process and the pack out process, the validated process for your cold chain shipping, and making sure that that has been validated and that they are following those protocols. Other things that they'll be looking for to make sure that the integrity of the medication is kept during the packaging and the shipping process. Things like light sensitivity. How are you identifying those medications that are light sensitive, and how are you addressing that during the packaging and the shipping process? This is also part of the drug storage when we get there as well. And then they'll also observe during your pharmacy tour as far as what kind of tools that you have to identify certain packing requirements. If it needs to be refrigerated, are you using different kind of bins or baskets for medications that may require refrigeration? And therefore, you're kind of showing your packing technicians exactly how it needs to be packed out using the cold chain pack out process. Sue, anything to add?
No, I think you've covered it. Thank you, Judy.
Awesome. And Lesley, do you have anything to add on either this or the earlier issue you were discussing with the state regulations?
Yes, I just wanted to add that I do the core aspect of all of the pharmacy programs when we do the on-sites and the desktop reviews. And that question about the labeling comes up in marketing, it comes up under compliance. So everybody needs to be able to tell the same story about it. So I just wanted everybody to be clear about that. Thank you.
Thank you. Our next area of commonly missed details that can have a huge impact on your pharmacy accreditation has to do with hazardous medications and hazardous materials. Sue, why don't you get us started on this?
Great. Thank you, Sana. The first thing I would tell you is to make sure that you have a well-defined definition of what hazardous means, and ensure that your staff has a resource available for them to help them define it, make sure that they're all speaking the same language. This will come up in the pharmacy supervisor interview. It'll come up during the tour. It comes up in various places. And then making sure that you identify a process flow that works best for your organization. So I've seen organizations where they might have a hazardous room and everything is maintained in that room. I've seen other organizations will have a color-coded shelf that identifies all their hazardous material. If you were seeking ACHC accreditation, it requires a label on all your hazardous material. And then looking at resources to help you define what hazardous medications are, what hazardous material would be. And that would be your NIOSH list. That's well documented there. And then making sure that you've identified where you're going to quarantine hazardous material that's no longer usable, and what that destruction process looks like. Is it different than your reverse distributor that you use for other medications that are not hazardous? Judy, anything else that you'd like to add?
The only thing I'd like to add is basically give a tip. When I was wearing the URAC reviewer, pharmacist reviewer hat, and I would go into a pharmacy, I normally would understand and know how they have defined their hazardous medications and materials. And from that, I would usually have in my pocket one or two of those hazardous medications and actually go identify it according to their policy on their shelves. Give you an example of one that tended to be one of a problematic one would be testosterone injection. And basically I can ask to see that particular medication, look to see how they've stored it. And the reason that one kind of comes up as a problem is because of the control issue with that. And sometimes those would be missed. So just make sure that you do have your auditing and making sure that all of your hazardous medications and materials as defined in your policy are indeed labeled and stored according to your policy.
Excellent. Thanks, Judy. Lesley, anything to add on that?
No, good.
All right. Well, then let's move right along to cross-contamination, which is a hot topic. Judy, what do you have to tell us about this?
As far as cross-contamination being part of the review during the pharmacy tour, again, your pharmacist reviewer is going to be observing your dispensing process. They're going to identify what tools you have in place in order to prevent cross-contamination. And of course, those are defined in your policy that you submit during your desktop review. And so according to your policy, whatever's in your policy, one of the things you normally find is counting trays being addressed and dispensing type of machines being addressed, and how you are preventing that cross-contamination, whether it's using a separate counting tray, which is labeled, especially with highly sensitive medications such as sulfur or penicillin type of medications. Oncology counting trays may be separate as well. And then, so they're going to look for those. It's a low-hanging fruit to make sure that you have those ready. You've got them labeled, you've got them cleaned, you can pull them out and show them, this is how I'm doing it. And it can be short and quick just to meet that standard for cross-contamination.
Sue or Lesley, anything to add on that?
I would just like to identify one area that sometimes folks forget about. And that's if your system, a lot of organizations have a very, it's all automated, a lot of automated conveyor belts and things like that. And I've seen organizations have a conveyor belt that has the ability to take it to a quality area where they will randomly pull things from the conveyor belt and count them, making sure that it's the right drug, that it's the right number of drugs in the bottle, and they use counting trays a lot. And they don't think about those medications that are hazardous, and then they're counting the next medication, because remember, this conveyor belt is moving quickly. And so, and there's usually a few people in the queue that's doing the quality piece of it. So you want to make sure that you're looking at that piece as well.
Thank you, Sue. Just a reminder to everyone out in the audience that your questions are more than welcome. Feel free to post them in the Ask a Question section down and to your left, or to post any comments over on the right where the chat notes are being shared. All right, moving right along. Our next area of tiny details that have a big impact on whether or not your pharmacy is accredited have to do with how you receive medications. Sue, what can you tell us about this?
Okay, so as part of the tour, they will go into the receiving area. They'll interview the person who mans that area, asking them how they receive the medication. Is there a specific vendor they would accept the medication from, that they get their medications from? They would talk about, is it part of their responsibility to monitor those vendors, making sure that they can get pedigrees for the drugs, and also identifying for medication integrity. So if you get a package that's damaged, what is their protocol for handling? Or if something looks different, have they been trained on how to recognize counterfeit drugs? And looking for what are the protocols for receiving narcotics? Who may receive them? How do they ensure that what they ordered they received? So what does that process look like? So prepare your staff that man that area to make sure that they can address those areas, that they have a clear understanding. And then one of the other things that they tie into is how the new inventory is entered into inventory. So who's responsible for putting them on the shelf? If it's a hazardous medication, who puts the stickers on, things like that. Judy, anything to add there?
The only thing I was going to just expound on a little bit is the monitoring of the vendors that you mentioned, and to just kind of prompt a little bit of thought about how you would be able to show evidence of compliance that you have and you are monitoring your vendors according to your policy. Sometimes that might be just an annual review or documentation of their licensures as well as their certifications. But again, just kind of keep in mind of what you can have on hand on that day that's easily accessible to show them that you are indeed monitoring your vendors and making sure they are wholesalers, reputable wholesalers, manufacturers where you're getting your medications.
And some of the more well-known ones will actually hold a BOD certification. So if you have a copy of that certificate, that would be helpful to have on hand.
Well, thank you both. Let's move right along into talking about medication storage. There is a lot that goes into this, so we'll have Judy kick us off, but I'm sure we'll get lots of ideas in here as we talk about this.
Thanks, Anna. Actually, it is a fairly big part of the pharmacy tour because there's a lot of things to look for during as far as the medication storage. So Sue and I'll probably bounce off of each other. To start us off, one of the things that the pharmacist reviewer will discuss with the person who's doing the tour, which normally is your pharmacist in charge or your lead pharmacist who might be performing the tour and being able to show the reviewer provide the evidence of compliance. But one of the things that the discussion is going to be had with that person is how are you identifying and how are you reviewing for expired medications to identify any unacceptable medication as part of your stock. So you'll be able to speak to how you identify expired medications, and with that, be able to show them. A lot of times we see stickers used for identifying when a product is going to be expired. And then sometimes it might be a different color sticker depending on how soon that medication is going to expire. And from that, when you take those medications off the shelf, where you put those medications, you quarantine those medications, and then be able to speak to what happens to those medications. Do you send them back to the manufacturers? Do you send them via reverse distributor for destruction? So be able to speak to those as far as expired medications as well as any unacceptable medication. One of the things to have on hand and be able to provide for the reviewer is an example of a recalled medication, so that you can show the reviewer and walk the reviewer through the process of that particularly recalled medication, and that it has been, whether it was identified as having it in stock, be able to speak to that, be able to speak to how you would identify if it had been in stock, how you can identify what patients it has affected, how you've outreached to that patient, your process for that, and then what you would do with that medication should it be returned, or how do you direct the patient on what to do with that medication. So again, the first part of that we'll touch on is basically looking at your unacceptable medications or identifying those, and making sure, the other part of that is making sure that they're stored within the manufacturer's guidelines. Which kind of leads us to refrigeration, frozen, your freezers, your ambient temperatures, as well as your humidity. And so I'll just kind of touch on the storage requirements which are affected by this. Again, it's a really important part of the observation tour, the pharmacy tour, to make sure that you have those refrigerator logs, that you're able to show evidence of compliance, that you are monitoring those refrigerators and those freezers and the ambient temperature as well as humidity, and be able to speak to your temperature ranges that you've defined in your policies and procedures. And the other thing you have to speak to with this is how you are alerted after hours when you're not there that there's been a breach of the range in the temperatures for whether it's refrigerated, whatever it might be, that those temperature ranges have been breached and someone's been notified, and what you do about it. Sue?
And if I could jump in here, one of the things that we would recommend is that right before your URAC visit, if it's a URAC visit and it's not unannounced, like for instance for ACHC, that you do an audit to make sure you remove any expired drugs from your shelves, okay? And then the other thing I wanted to talk to was narcotics, making sure that staff can address what narcotics are locked, if any, what narcotics are amongst all of your other medications. Sometimes that's decided by your State Board of Pharmacy auditor. Some of them have a preference for them to be housed amongst all the other medications. Other State Board of Pharmacy auditors say, no, all of the narcotics have to be locked. So what is your protocol? And then making sure that it's very clear that your staff know the protocols. So who can access them? What type of clearance do they have to have? They may ask about any reporting that you may have to do related to narcotics. Like, for instance, is there an auto feed daily required by your state on which narcotics were dispensed? Your state board may require you to have an outside auditor come in once a year. So whatever your protocol is, and it's most likely based on what the state requires as it relates to your narcotic dispensing. And then making sure that folks who have access to narcotics have had that background check and have had drug testing is really important as well.
Sue, if it's okay, I was just going to add to that.
Go ahead.
I was just going to add, as far as narcotics, a lot of times when we speak about narcotics, a lot of pharmacies key in and focus on C2s. But the standard doesn't just address C2s. The standard is addressing all controlled substances. So you need a policy for your C2s as well as your 3 through 5s. And if they differ, if you're doing your 3 through 5s dispersed on the shelf versus your C2s being locked up, then you have to be able to still show that you are auditing and what you're doing to ensure that those 3 through 5s are accounted for and they're being managed. Though State Board of Regulations or DEA regulations may allow for 3 through 5s to be on the shelf, the URAC standards are still pushing you toward managing and accounting for all controls.
Thanks. And Lesley, you had something to add on this as well?
Yeah, there are, just going back to the temperature gauges and making sure that there's something that's going to notify you. There's a lot of mobile apps out there that are being used. And it's not just for after hours. You're going to be busy in your day and you're not going to be able to follow it. A lot of people have a thermometer up on the wall to help you, for example, with temperature and humidity. But you really do need to know at all hours how it's going. Something needs to notify you. The other thing I just wanted to touch upon, Sue, I know that we've been to and Judy, we've been to very small retail pharmacies that are going for specialty pharmacy. And so they always ask us, do I need to have a separate room for some of the drugs, or how in a very small space can you accommodate that?
This is I'll answer that. So what I would tell you is that it's dependent upon your organization and what space you do have. I have been in the smallest of pharmacies where everything was in the retail space. I have been in organizations where they have a door that leads up the steps to a second level and the drugs are stored in that locked area going up the steps. You have to make sure that you're in compliance with state boards of pharmacy requirements and that you can assure that the medication is being maintained to keep its stability and integrity. That's the key part, as well as being in compliance with the state boards. Judy, anything to add?
No, but I did want to readdress something with expired medications when we get a chance. So.
Go right ahead.
All right. One of the things I wanted just to kind of give an example as we're kind of looking for practical examples of what a reviewer might look for is looking back at expired medications and storage, while we're still talking about storage, is think about your compounds that you have. If you're doing compounds, or if you have, even if they are, if they are part of your specialty pharmacy, but they're not a specialty drug that you've compounded, the reviewer still is going to look at how you are stocking all your medications. So I know when I've been a pharmacy reviewer, that one of the things I can do is usually open a refrigerator, especially in a compound area, because usually when you compound something and your beyond use date is going to be limited, those things sometimes run out fairly quickly. And so I usually can put my eye on something that has expired, and I get to really see if a pharmacy is indeed able to identify expired medications before they before they expire, and pull them off the shelf prior to by looking at compounded medications.
Great. And when it comes to your refrigerator, your freezer, your humidity, is there anything else any of you want to say about that, or you feel like we pretty well covered it?
Just having the logs available for review. And remember that with the freezers, it's not just limited to freezers that are used to house medications. It's also, URAC considers those freezers that have your gel packs or ice bricks. They are in scope. So you have to monitor those freezers as well.
Right. Well, thank you all so much for that information about storing medications and making sure we don't go out of compliance there. And since we ended on logs, let's actually spend a little bit more time on logs in general. Lesley, I think you had some thoughts about this.
You know, when I did the reviews, just tagging along with our clinical folks here, Sue and Judy, one of the things that I found, and I know it's low-hanging fruit, but it really can lead to a problem, is the logs. Just in casual conversation about the logs, we do find a lot of problems with different topics. So, Sue, do you want to lead off on that? I know it's one of your sometimes things.
Okay, yes, sure. Okay, so as you may recall, there is a requirement for calibration logs, cleaning logs, a log that identifies that you're doing randomized testing, and then someone needs to audit that. So if you remember, those are all mandatory elements. So while it may be low-hanging fruit, if you get this wrong, you're going to be denied accreditation, and we don't want that to happen. So making sure that you have some mechanism to demonstrate that that calibration has been done. I will tell you, one of the tricks that we always use is looking at what the manufacturer recommends for the calibration. I recently had a client that said that they were calibrating their Kirby every day. And I'm like, oh, that's really frequent. The best I remember, it's like once a year or something along those lines. So making sure that you're looking at the manufacturer recommendation, because if your policy is tighter than the manufacturer recommendation, URAC will hold you to that. So remember, it's whatever is tighter. So in this instance, I would rely more on what the manufacturer has indicated is necessary and making sure it aligns with your policy. That may save you some work, unnecessary work. And then making sure that you have a sample available for the reviewer. Some organizations rely on electronic, other organizations will have it on a clipboard. One of the things that you may want to do is include all of the elements on one log, because then you can quickly see that something is missing, and make sure that you have a place to sign off that the log has been audited to make sure that it has been completed as your policy indicated. And knowing the difference and knowing what randomized testing means. That means outside of your normal range, that periodically someone is testing that equipment. So including that as well. You may have equipment that must be serviced and calibrated by the organization's service agent, making sure that you are aware of which equipment that is, and then having documentation related to that. Judy, do you have anything to add?
One of the things I'd like to add is just kind of reiterating about identifying the equipment and whether it's in scope of the accreditation or not. And really stress the fact that there may need to be a conversation with your lead reviewer, as in what equipment you do have, and if you are using that as part of your specialty services. And if you're not, I would still have that conversation so that the reviewer can understand what you do have, and that it can be agreed upon whether that equipment is or is not in scope. What I've seen as a reviewer is when I get a desktop review, a policy, and it basically says we have no equipment. And so I mark it not applicable because I'm expecting to find no equipment. And then I walk into the pharmacy and the first thing I see is equipment. And I'm going to start asking them for logs. And those are all mandatory standards. And so right there I know we've got issues because they've got equipment They've told me they don't have equipment, and there is equipment, so it definitely needs to be identified whether that equipment is in scope and will need to be in the reviewers, whether the reviewers should expect to find logs for those. The other thing that I would recommend is basically, again, having those logs ready, having them available during the pharmacy tour so you can show exactly per each individual equipment that you have that's been identified, that you can have either one log covering it all or however you've got it, but you've got to have your logs ready for them to review. And as part of that, as Sue mentioned, if your calibration should really kind of mirror the manufacturer's recommendation for calibration of that equipment. And if it is the manufacturer's recommendation that is automatically calibrated and no additional calibration is needed, be able to have that information available and to show them, because on your log it should say not applicable, look at, per manufacturer recommendations, and have that. The other thing as part of your logs that I've seen as a reviewer with issues is basically the auditing and signing off that you have audited, or you have someone that it's their responsibility to do the auditing to make sure the equipment is being calibrated, it is being cleaned by policy, and it has that randomized testing. So make sure that your template that you're using touches all of these elements so that you will not miss any on your validation review.
Awesome, Judy. Thank you. All right. Anything else on logs from any of the three of you?
No, nothing.
Okay. Then let's move on to pharmacy security.
Lesley.
There's
I'm going to take
a
that
funny story that Tom likes to tell about pharmacy security, about when he visited a pharmacy and found the back door not to be very secure because there had been thieves hammering at it viciously trying to break in. And the URAC reviewers were coming. Judy was actually one of the URAC reviewers for that pharmacy, and they lickety-split had to get that door replaced before URAC got on site. So pharmacy security is very important. And what do y'all have to say about it, Lesley?
Well, there's really two things to this privacy and security part of it. So one, of course, is making sure that we're meeting our pharmacy state board laws around dispensing and ensuring that there's a lot of privacy and security protocols and policy and procedures around it. The other is making sure that our pharmacist is the one who's the first one in and the first one out when you have the pharmacy open. Now, there's a lot of retail parts to the business, and that's fine. But anytime that you're going to open up the area where there's medications, you must have a pharmacist. We've gone to a lot of organizations where the ops person is opening it up, and that's against the URAC accreditation. And it's actually against a lot of the state laws as well. So please make sure that you are very mindful and aware of what your state regulations are about it. Do you have anything to add to that, Sue?
Oh, just saying, I think you meant first in and last out, right?
Yeah, I did.
Okay. Okay. I just didn't want anybody to say, hey, that's a new rule. And remember that the first in, last out rule applies to the dispensing area. Like if you have a retail side of it, as Lesley indicated, it's okay to have someone else open up at the dispensing area. It has to have a pharmacist there at all times. And I think that's, as part of the tour, they'll be looking for things like security cameras. They'll be looking for, if house staff sign into the system. I will tell you one horror story. I was helping an organization get ready for accreditation, and they had one user ID for their patient management system that they all used. I said, no, you can't do that. You have to have separate logins. So making sure that those types of protocols are in place as well. And since you mentioned privacy, one of the things that I will remind you is if you have shred bins in the pharmacy, making sure that someone can't reach in the shred bin and pull out PHI, because I have seen the URAC reviewer actually test for that. I've seen pharmacies where the stickers from the labels have all got stuck on the lip of the shred bin, and so that you can see PHI, so making sure that that's handled as well. So just keep that in mind as you're thinking about not only the security, the privacy end of it.
Yep, it's actually a good idea to have the Shred It folks come really close to when URAC's going to be there, just to empty it if you feel like you're getting full.
Yep, exactly. Okay, I think Judy's next up to talk about the eye wash stations and spill kits.
And thanks, Sue. Prior to me getting into that particular subject, I just wanted to kind of give an example of some security issues that I've seen when I've been on site and doing the pharmacy tour. And actually, I've seen more than enough security issues when, as we've kind of discussed with this particular section, you would think it would be something fairly easy to meet compliance, but a lot of times there's ways that reviewers have to determine exactly if you're following your policy and procedure, which also should mirror your Board of Pharmacy regulations. And one of the things I can do as a reviewer is basically find out who has keys to the pharmacy. A lot of times there may be some non-pharmacist owners that will have keys to the pharmacy. And if your state board and your regulations do not allow for that, which most of them do not, because it needs to be that a pharmacist is there and present. So I'm usually going to find out who's got keys, who's got security codes, who's got control of those security codes, so that I can try to find out exactly how secure that pharmacy is. I know there is a state regulation, I believe it's in New York, where it talks about non-pharmacist owners can have keys in emergency situations to access. But if you actually look at the verbiage that's there, it does not allow that non-pharmacist owner to have keys. So again, look at your regulations, look at your policy, and make sure that you can speak to, and if people are asked, your pharmacy staff are asked who's got keys, who's got security codes, that they can speak to the level of security that they have in that pharmacy, especially in the pharmacy storage area, the medication storage areas. So.
And if I could add one more example.
Absolutely.
Sorry. And propping doors open. Sometimes it might be warm. Like if you have an area where you have the dispensing area and you have a door in between it and where you might do your initial intake, please don't prop those doors open. URAC will cite that almost immediately. They'll see it, no propping of doors. So making sure that folks who have access to the dispensing area are the only people that can walk in willy-nilly.
And speaking of access, we did have a question come in about the shred bins. Des is wondering if the access is restricted to pharmacy staff only. The bins still need to be configured so that a person can't reach in and pull out PHI.
If access is restricted to pharmacy staff, do we still need to? No, you want to make sure that, like for instance, you don't want the reviewer to come in and be able to pull out PHI. They're not someone who's part of your pharmacy. You wouldn't want a cleaning person to come in and pull out information out of your shred bins. So I would just make sure, I don't know that it's restricted. It's just that you don't have to restrict access to the shred bins, just that people can't reach in and grab information out of it. It's because they're so full.
But I think what they're asking is if that access is restricted and nobody but pharmacy staff is able to access the bin to begin with. But even then, the URAC reviewer would need to see it, right?
Right. The URAC reviewer, oftentimes you have cleaning staff that come in even though they've signed documents, you don't want to have the chance of people reaching in and getting it.
All right. Well, thanks for that.
Sana, may I add something to that?
Please do.
One of the things, a caution that I would have is that it sounds like the question may revolve around the dispensing area having the shred bins versus maybe the business office areas or other areas of the pharmacy having access to the shred bins. And one of the cautions I want to say is there needs to be shred bins available where there's any patient information that does not need to float around. It needs to be able to have access to those shred bins so that there is not, because that is one of the things that the pharmacy reviewers are looking for. They're looking for floating patient documents. They're looking for things that might be turned face up versus face down. And they're looking to see where those shred bins are in accordance to where that type of work is being done, where there is patient information being manipulated. So I just want to say, just cautionary, yes, have the shred bins. They do not have to be in the dispensing area only. They would need to be within your confines of your overall pharmacy service organization.
Awesome, thank you. And now I think we are ready to move on to talking about iWatch stations and spill kits and MSDS as well along with that.
Absolutely. To me, this is probably the lowest hanging fruit of the pharmacy observation tour. And basically, you know it's a mandatory standard that you have an iWash station. You have to have a spill kit. And they would want to see access to MSDS. I know that when I've been a reviewer and when I provide mock validation reviews for our clients, one of the things I'm going to ask them as I do my pharmacy tour, I'll ask the staff, first of all, how can you access MSDS or SDS, to see if they even are aware of what that might be. And then the second part of that, if they understand what that is, how do you access that? And so what we've found is most of the time this is electronic, and which is great because usually you can just have a website that you have a subscription to. People have the logon, the passwords in order to be able to pull that information up. And I actually asked them to show me how they would do it if there was a spill. Show me how you would look this particular material up on the MSDS website, if that's their source. If it is a paper MSDS resource, I'm going to look to see what their process is to make sure that it's up to date. And how can you show me that it's up to date through your process that you have in place? So be able to speak to that. Go ahead and have your MSDS tabbed on your web browsers as far as being able to access it quickly. Again, I go back to how long you have to be able to show this pharmacist reviewer what you are doing to be in compliance. Already have it ready. Have everybody trained to know where it is, know what that is, how to get to it, and how to access it. And then the other thing is your spill kits, make sure that they are there. I use the word plural because usually if you have only one spill kit, you may use that spill kit right before your validation review, and then you have to make sure that you have a spill kit at all times. So think about having a backup. iWash stations can be numerous different iWash stations, so it could be saline solution stations, or it can be those that are over a sink. So make sure that not only that you have iWash stations, but it is accessible. I went into a fairly large healthcare organization, and of course, as with a healthcare organization, they have a lot of iWash stations. But in this particular case, it was outside of the pharmacy, the specialty pharmacy that I was reviewing. It was just next door. And so they were arguing the point that they have access to the iWash stations. But the problem is that the pharmacy was open longer than that next that next department. So after hours, they had no access to that eyewash station. So the conversation was, you have to have that in your pharmacy, access to your pharmacy, and be able to get to that eyewash station should need be. If it is something that is of a bottle solution, you've got to make sure that that it's in date. First thing I'm going to look for is the expiration date on the spill kits, if the spill kits have an expiration date, as well as on the eyewash solutions that are being used. Sue, do you have anything? I think that's all I've got.
Yes, I have one other thing I wanted to mention. If you're storing the spill kit, your SDS sheets in a cabinet, you have to label the cabinet identifying that the spill kit and that is in that cabinet so that staff can see at a glance. I will tell you, as many tours as I've done, I always ask the question, can you tell me where your spill kit is? And I always get the deer in the headlight look. So I will tell you, no matter how many times you think you've told your staff where they are, as part of our, if you're using IHS to help prep for your accreditation visit, that's something that we offer as part of the tour. If you're doing it on your own, make sure that you are asking the staff that before they come. Comes on site. Remind them where it's located at. Remind them how to use it, and because that's something that you really don't want to lose points on. And
I also wanted to bring up that if you are using a saline solution, it's only good for 30 days. So you want to make sure that if you open it after 30 days, it's time to open up a new one.
All right. Anything else about really anything that we've talked about so far? Do you think of anything after the fact that you wanted to circle back to?
Do we have any questions?
The only thing, sorry,
go ahead, Judy.
The only thing I was going to mention about the eyewash is just to make sure, and maybe it was mentioned and I missed it, but if it is saline solutions, look to see if you're, once it's been opened, that you are within your beyond use date. Some of those are 30 days once it's been opened. So just make sure you're in compliance with your policies for that if it is a solution. That's the only thing I needed to add to that. Thank you.
And we mentioned it twice because it really is commonly missed, and it's such a low-hanging fruit and easy one to catch. So really do go through and check and make sure that you see when those solutions are open. All right, we do have one question hanging around from someone's registration form. And the question is about what is the most common problem that we find during the pharmacy tour. And you all might have different opinions on this, but let's go ahead and see what you have to say.
Okay, I'll take first stab at it. I would say the most common thing that I see is, well, there are two. The labeling laws, folks not being able to answer those questions. And then sometimes folks will have like just pallets full of shipments. They're going to be going out that have been sitting there all day, waiting for the end of the day. On the day of your visit, I would recommend that you would schedule them to come even a couple times so that they're not sitting around. Judy, do you want to take the next stab at that?
You know,
what you see as the most common?
In my experience, it's been kind of smattered across the board. There's been a little bit of each different type of standard missed. I guess if I had to say one particular one, it would be the drug storage, where I can walk through a pharmacy and find either hazardous medications that have not been labeled per their policy and procedure and not stored per their policy and procedure, whether their freezers do not have logs, or I can find expired medications. Usually where I see compliance issues is going to be the drug storage. So really make sure that your process is, I can't tell you how many expired medications I've found on shelves. And this is after they said they've been through looking. So, which also meant to me that their processes are not working. So I would say really key in on your drug storage and make sure that you're following your policies and procedures for identifying and for identifying drug storage issues and writing up your corrective actions for those.
Leslie?
So having been on site with both of you, the themes that you guys come back to me at the end of the day are the logs, that you found something else because of the logs. Cross-contamination, such as finding, for example, maybe it was unclean equipment. You found sulfa just on the equipment, and that's a problem. And then the third thing that's really interesting to me is that you always say that the PIC is the pharmacist in charge is always nervous, and they're nervous about their interviews, but that during their tour they do great and they know it well. So I just, for everybody who's listening out there, just trust that when you do the tour, you're going to do a great job and you're going to answer a lot of the questions already during the tour. So just feel good about that. We've seen it time and time again where the PIC just really comes through in the interview.
Great observations, Les.
All right. Well, thank you so much. If anyone else has any other questions, we do have about 5 minutes left, and you can put them in the chat window or in the Ask a Question box. Beyond that, thank you so much for joining us today. We really are getting a kick out of doing these webinars, and we're looking forward to doing more. And we'd love to hear your ideas for what you'd like to see a webinar on. So again, you can post those in the chat window. You can email us directly, info@integralhs.com. And we'd just be thrilled to put together a webinar on any old topic that would be of interest to you all. If you have any questions that are a little more specific to your pharmacy or your situation that you maybe didn't want to ask in the broad group, but you'd like to talk one-on-one with one of our consultants about, you can click the link below that's about to pop up to schedule a consultation with either Sue or Judy and ask your questions. Other than that, we will be announcing next month's webinar topic, so watch your inboxes. If you're not on our mailing list and you'd like to be, let us know, or just visit our website to sign up so that you can get notified every time we announce a new webinar. And we'll also send out all kinds of awesome information, like updates on what URAC is up to and nuggets about standard interpretations. Those also all get posted on social media, so you can follow us on Facebook, on Twitter, on LinkedIn. And later today, this webinar will be available as a recording at this link, and we'll send out the link again tomorrow. So don't worry, if you misplace it, it'll hit your inbox again. Do any of the three of you have anything else to add before we close?
No, thank you all.
Thank you.
All right, well, thank you all for sharing your expertise, and I look forward to the next one. Hope everyone has a great rest of your day.
Thank you.
Bye, guys.
Thank you. Goodbye, all.